Okay, everyone, we'll get started now. Thank you so much for joining today's Community Food Responses during COVID-19 meeting. My name is Rosie. I am the Neighborhood Parks Educator at the Jane-Finch Community and Family Center, and I will be moderating today's conversation. This is an opportunity for us to have a community conversation and a discussion to learn about the different food responses that are going on in Jane-Finch. So we're going to interact with local groups responding to food insecurity in Jane-Finch, looking at ways we can work better together, and also looking at strategies so that we can address food insecurity after COVID. We want you to be really engaged in the conversation through participating in the chat. And this webinar is going to be recorded. So if you are interested in having this recording later on, please feel free to leave your contact information in the Google form, which is in the chat right now. And if you do have questions, again, please leave them in the chat and they will be answered. Okay. So before we get into the speakers, I just wanted to go over a couple of housekeeping items. So if you haven't already done so, please mute your microphones. This will just allow for a better flow of the conversation. We will have a question and answer period, so you will be able to ask a question using your video chat, but I will let you know when that time comes. If you are calling in, to mute yourself through the phone, you want to press *6. And that will be the same for you when you unmute. And to raise your hand, it is going to be *9. So again, like I said, we definitely want you to be engaged and leave questions and comments. So definitely if you have any questions or comments before the Q&A period, please feel free to leave them in the chat. And if you have any specific comments for specific speakers, feel free to indicate that in the chat as well. And again, like I said, this meeting is being recorded, and if you're interested in having the recording, leave your contact information. And your contact information can also be used to stay in the loop about what's happening in the community. You'll be added to our mailing list. Okay. So here is an agenda, and I just wanted to again welcome you, just to let you know that we just thought this was an important and timely conversation to have. So it's amazing to see the turnout and just the amount of speakers that were willing to participate in this conversation. During COVID, we really want to address what's happening in the community and look at ways to ensure that we are putting residents' needs first and looking at ways that we can work better together. So here's an agenda of what we will be discussing today. So we went through the introduction. We're going to hear from our speakers. There will be a question and answer period. There will be an opportunity for other organizations to share what they're doing. So if you are here from an organization, we will provide you with an opportunity to let the participants know and everyone know what's happening at your organization, and let them know ways that they can access your services or get involved. And there will also be an opportunity for a group discussion. Okay, so here are our speakers for today. I'm really excited to announce our speakers. We have speakers from 4 local organizations here. So everyone will have an opportunity to speak for about 10 minutes. And like I said, if you do have questions specific to each speaker, feel free to include them in the chat, and speakers feel free to engage in the chat conversation as well. We really want it to be as interactive as possible. But again, when speakers are speaking, we do ask that you keep your microphones muted. So today's speaker, we have Alicia Karji from the Jane-Finch Family and Community Center. We have Letitia Diawu from Black Creek Community Farm. We have Anand Lolali from Afri-Can Food Basket. And we have Butterfly Sabrina Gopal from Black Creek Food Justice Network. So thank you everyone for participating and being here today. We're really looking forward to having you speak and to hear what's going on in the community.
Thanks for having us, Rosie.
Hi everyone. My name is Alicia. I'm from the Jane-Finch.
So we're gonna start off with our speakers. And our first speaker will be Alicia Karji from the Jane-Finch Community and Family Center. Alicia is the manager of Family and Financial Services, and we're really excited to hear what's happening at the Jane-Finch Family Center.
Hi everyone. I'm Alicia. Thanks Rosie and everyone here.
Sorry, we can't hear you. Or I can't hear you.
Okay. Can everyone hear me now? Wave. Yes, people can. Okay.
Can people hear you? Okay.
Okay, sorry. I'm Alicia, as Rosie said, from the Jane-Finch Community Family Center. So thank you for having me. As Rosie mentioned earlier, this is really an important conversation for us to get across in the Jane-Finch community and those of the surrounding who are on this call. So I hope everyone's able to take away something from it today. So I'm just going to speak a little bit on what Jane-Finch Center has been doing. I guess pre-COVID and also when COVID started. So we effectively closed our center as of March 16th, and we began doing food hampers for the Jane-Finch community and those who are a part of our center, as well as those living in the community. We are currently doing our hampers weekly. We have redeployed our staff within our center and different departments to just manage different things, whereas that could be deliveries, doing the food hampers, purchasing the food, and, making calls to our clients. So with that said, we have a lot of clients and with all the agencies on this call, we all have a lot of clients that we speak to daily. So our staff have been involved in just kind of following up with how everyone's doing and just making checking calls and kind of finding out where everyone is, during this time and how they're doing, what are their needs, and how we can better service them into the community. So Jane-Finch Center, like I said, has taken on doing hampers. We do regularly receive donations from the North York Harvest Food Bank, which obviously isn't enough to service our community. We have been receiving donations from a lot of people who we've been reaching out to. So whether that could be, Walmart, Freshco, IKEA, kind of other agencies within the Jane-Finch community to keep the, the money in local. So we have been able to service about anywhere from 100 to about 150 clients weekly. And these clients are getting calls from our staff, following up with them about their needs and wants during this time. I'll definitely say we have been seeing, a lot of need around having the food insecurity. So we're doing our best to kind of help where we can. One of the things we have, fallen short on is being able to provide fresh food for our clients. We're really unable to meet, I guess, dietary needs for those of our clients as well. And that is because, we don't have that capacity to have fresh food in our space. We don't have the capacity to, I guess, keep that for a long time and get it out in a fast enough period to our clients. So we have been doing the non-perishable items, which has been working really well, and we're getting some good feedback from our clients as well. So I think for the most part, we're trying our best to help those in the community and get that need serviced. We have also been able to reach out to other agencies and do partnerships with, for example, HelloFresh. We've also done partnerships with Black Creek, who's on this call. So able to get the fresh food across to the clients in that way, but not to the capacity that we would like to. So we're still working on, getting those numbers up weekly. Our staff are continuing to make the calls and find out, what the client needs are where we can. I don't know if anyone has any questions or in regards to anything else that we're doing within the center, please feel free to let me know.
So Alicia, we did have a question from the audience. So what kind of item, you kind of touched on it already, but what kind of items are in the food hamper? So you did mention the non-perishable and challenges with the fresh food, but if there was anything specific you wanted to share there.
So it's really we're working on a budget. You know, as with everybody, we don't have an endless budget to purchase these items. We're able to get donations from, whether it's food in itself or whether it's a monetary donation from agencies or from donors itself. So it ranges every week. We're kind of going, you know, what's on sale, because I'm sure, as all of you know, prices have gone up, although they have promised us that it wouldn't. So we're really trying to, I guess, focus on a hamper to help a family at least through a week, you know, and with that said, we put items such as pasta, salt, flour, sugar, kind of the necessities of what, you know, we've been able to get feedback from. We have, you know, been trying to take in, you know, items such as, you know, not putting ham in a hamper, because, you know, we're limiting to those clients who don't eat, you know, meat or, you know, fish. We've been trying to throw in, you know, items from our Cactus Food Market, which is in the Jane-Finch Mall. So to keep the money in the mall, we've been trying to do that. We've been trying to include items. We've gotten some feedback, I guess, from our staff. I work with the Early On Center in the Jane-Finch Community Family Center. So our staff have given feedback that, you know, items may not be, I guess, culturally associated. So we've really tried to do that where we can. But again, we are addressing a larger community, so it's very difficult to do that in specific hampers. So all of our hampers contain the same thing weekly.
Mm-hmm. Oh, thank you for that. So there's a couple more questions actually. So the question is, have the needs of clients changed as a result of COVID? Have you seen changes to what people need and the supports that are being asked of?
Based on the feedback we've been getting, I think there's always an ask for more in terms of what is going in the hamper, whether it's not enough, and definitely, you know, dietary items, which we are actually unable to do at the moment, and a lot more healthy options. Not to say that our hampers are not healthy, but I think if everyone could receive fresh items on a daily basis, it would obviously be a preference. So we have been getting that feedback. But again, not so much a need that the need has changed. We get questions around, you know, are we able to do items outside of food? So whether those are hygiene items, sanitary napkins for both children and adults. So we have gotten those requests. We're currently looking into how we can service those families as well.
Mm-hmm. Mm-hmm. Okay. And a follow-up question to that is, have you seen the donations change as well? Like, have they decreased, or do they look different?
No, I'm not going to say that donations have decreased. The donations we've received actually have been quite a lot. So we've put those out to our families in terms of what we have received. We've had, you know, very generous donations from our mall owner as well, which was able to give us a monetary donation, and we've put that right back into our food hampers to purchase food. So no, I'm not going to say that we've seen a decline. I definitely think that everyone has a busy time right now. So whereas, you know, we would expect a response within a week or so, it's probably a little bit more delayed. I'm sure everybody's inundated with emails and donation requests. So no, I'm going to say no, that I haven't seen a decline in that.
Okay. Well, thank you for sharing what's happening at the Jane-Finch Center. It's really great to hear how things are being responded to. Was there anything else that you wanted to share, or any ways residents or people can get more involved, and any ask that you have?
In terms of an ask, I think we're always looking to receive more donations, whether it's monetary or items. So, you know, we always try to get our word out, whether it's through social media or speaking to other agencies, and get out the work that we're doing to get those donors on the call, or even on a conversation to get donations for our food hampers. In terms of, I guess, you know, how community residents can get involved, it's just word of mouth. What we've been doing right now, I think the agencies that are involved in the Jane-Finch Center have been doing an amazing job to get the word out. For example, this meeting in itself had some great, you know, social media response. So that was good. I think it's communication at the end of the day, to just speak with one another and get the word out of there, what we're doing and what's available to them at this time.
Mm-hmm. Thank you so much. That was great. So we're gonna also have a question and answer period afterwards, a discussion. So there might be more questions.
Not a problem.
Okay, thank you. So we will move on to our next speaker. And that will be Letitia Diawu from Black Creek Community Farm. So okay, perfect. You are highlighted. So I'm just going to go over a brief bio, and please feel free to add anything that I missed. So Letitia Ama Diawu is a longtime resident of the Jane-Finch community and a mother of 2 children who has been a leading social activist in the Jane-Finch area of Toronto and across the city of Toronto for the past 12 years. In her capacity as a program worker, then a program manager, and now the director of Black Creek Community Farm, Letitia has shown excellent capabilities to engage residents, allies, and other stakeholders in struggles for community improvement and social and economic justice, including the realization of food security and food justice in Jane-Finch. She has helped facilitate the formation of the Black Creek Food Justice Network, Black Creek Community Farm Resident Council, and has managed to bring together a wide range of allies and supporters together to work for the enhancement of the community farm and the nonprofit urban food development in one of Toronto's most excluded and disadvantaged communities. Thank you so much for participating, and we're looking forward to hearing what you have to say today.
Thank you so much, Rosie, for the very lengthy bio. I was hoping you wouldn't read it all. And thanks for and thanks for having me. So yeah, just to give a quick background for folks that do not know about the Black Creek Community Farm, we're in the heart of the Jane-Finch community. Our main focus is, of course, really looking at food insecurity in our community, providing outdoor environmental education for children all the way from kindergarten all the way to high school. And also, you know, we are farm park. So our farm, when we before pre-COVID, was open to the public for people to come out, hang out, enjoy the outdoor space. Of course, we grow and sell vegetables as well, right, in the community for folks that live and work in the area. So I won't go that much into detail, and I will delve into sort of what we've been doing in terms of our community response to in light of COVID. So, you know, at the very beginning, I think it was March 13th or 12th, when the announcement came out about the shutdown in regards to COVID. As a community and with staff, we really sat down and said, you know, these are the challenges that our community is going to face. And COVID, of course, is exacerbating that the issue around food insecurity. You know, a lot of families will not have the, you know, $700 or $1,000 to be able to hoard food, right? To be able to buy all these food and to be able to sort of have them for their family for a week or for a month. So what are the ways that Black Creek Community Farm can support and do our part for our community as a way of us taking care of each other? So, you know, when we initially started, we thought maybe, you know, we would do 100 to 200 emergency food for some of the aunties in our community. And of course, that quickly grew to where now we're serving over 2,500 households in the community. So the emergency food program that we provide is really, we were able to get some donations from community members, and we use that donation to purchase emergency food box from Food Share Toronto, who is our partner and ally who has been sort of supporting this project forward. When we started, of course, we were the only organization that was doing this emergency food, to now where it has spread across the city and different organizations taking part, because I think when we started, everybody from even Ottawa was applying to get emergency food from us, but with different organizations participating, that has also taken the pressure off of us to be able to focus within our community. And I want to emphasize this piece around the work we're doing did not start out of charity. It started out of community members coming together to take care of each other. And to quote some Tekler from the steering committee, you know, we are all we've got. I would never forget his tweet that he sent out when we were asking for money for this project, was that we are all we got. and we got to take care of each other, especially in these difficult times, because we know that with all the dollars that's been announced through the government programs, that money is not trickling down to the people that really are vulnerable and really need it the most, the people that are facing the most systemic barriers that need it the most. So we knew that we had to act, and we had to act very quickly to really see how we can get some food to different folks in the community. So this week with Food Share, we're delivering over 500 emergency food boxes each week. We try our very best. It's all based on how much donations that we're able to get through the door. Some of the challenges have been, residents want to know, like, I got a box this week, am I gonna get a box next week? To give you an idea, to be able to feed over 2,500 people, that will cost you over $60,000 alone in order to be able to do that. So it costs money to be able to provide that food. And, when we started, we had no government funding or no support. It was just the goodwill of different people coming together and trying to sort of help us do some of this important work. So I'll leave it at that for now, and then just wait for the question period to delve in a little bit more. Thanks.
Thank you so much for that. I think it's really valuable to hear about the process of the emergency good food boxes, because I know personally I've seen how, I'm just paying attention to social media, seeing how the response to it and the need. So it's really amazing to see how that has progressed. But if you did have an ask of anyone of the audience, what would that be?
Well, I think it's sort of two or three folds. I think one, of course, we need support to be able to provide more food for families. But I think the second piece is that, Black Creek Community Farm, we are actually a very, very small organization with under $600,000 yearly operation budget. And we are doing this with a team of just 6 people. Of course, we had to get a lot of support from Food Share's team, from our steering committee, and from different community residents to make this work. But the truth to the matter is that we are also experiencing revenue loss for the fact that we're not eligible for any of the government programs. We're not a charitable organization. We're a non-for-profit grassroots group. And we are going to have a revenue loss of over $100,000. So there's that piece. But I think the third piece is around thinking post-COVID, right? So I think it's very, very important for us as we're doing this work to make sure that people are fed now, that we also get together to maybe some of the gains through COVID that we got for workers and workers that are deemed essential service workers. How do we come together to push to make sure that some of those gains stay? So it's not just you got this extra $4 to top up your pay because you're considered essential service only during COVID. Your essential service that is keeping us all alive pre-COVID and post-COVID. So I think the other ask is that, we work together and figure out ways that we can have a huge systemic change, because I'm really worried about what post-COVID looks like for communities like ours.
Thank you, Letitia. Those are really amazing points. And it'd be great to see what everyone else thinks in the group chat, just to speak on some of that, what will happen post-COVID, because a lot of these issues were already happening before COVID, and now it's just become exacerbated during this time. So it would be great for you to participate in the chat, leave some comments, questions that we can address later on. But thank you again, that's great to hear. And yeah, so we'll have more of a discussion later on in the Q&A period. Okay, so we will move on to our next speaker. So Anand, I'm gonna introduce Anand Lololi from Afri-Can Food Basket. Hi, Anand.
Hi, Rosie. How are you doing?
I'm well. How are you?
I'm good. Just physically exhausted. This is definitely a challenging period for all of us, and I know, yeah, all of us are just tired of these Zoom meetings and web meetings, and um, truthfully, it's been much more busy than usual work we do. Although we're not going out to work, these meetings online is like, you can't believe it. It had me working like 7 days a week, and most days I'm in front of a computer having a conversation, whether it be the city cluster or whether it be these national clusters, because of the mandate of the African Food Basket. But I'm glad to be here with Butterfly, Letitia, Alicia, and yourself and the Jane-Finch community. We've been working in this community for the last 25 years. We also mandated to work across the city, but many of our programs has been within the Blackfoot community, Jane-Finch community. So I'm just glad to be here to do what we could to help the community to make sure that folks have access to nutritious food and to keep the community healthy.
Great. We're so happy to have you here and looking forward to hearing more about the work you're doing. I'll just go over a little bit about your bio and feel free to add anything that I leave out. So like Anand mentioned, Anand is a food sovereignty and food justice advocate, musician, and a vegan for 44 years now. Wow. Anand is one of the founders of the Afri-Can Food Basket, a nonprofit food justice and food sovereignty organization that began in 1995 in Toronto. He has been the executive director for 21 years and interim ED for the past 4 years, promoting community food security, food sovereignty, and food justice in Toronto, North America, and the Caribbean. His passion is working in low-income communities to help create food-secure communities. So he has done extensive community work in the areas of equity, food justice, community food security, social justice, and anti-racism, including training, community development, organizing, and running equity and diversity management and youth leadership development programs. Thank you so much for being here today.
Yes, well, thank you so much for the introduction. I must say upfront that I am really proud of the folks who are involved in the food justice group in Jane-Finch. Food justice has been very close to my heart for the last 25 years, advocating for people of color all across Canada, but more specifically for Toronto. And it's good to see another generation of food soldiers. I know Butterfly will talk about that work in the Jane-Finch community. So for COVID-19, the mandate that we had with a project with the City of Toronto Confronting Anti-Black Racism Unit was putting together a coalition of Black activists and institutions to look at the state of Black food insecurity in Toronto in general. And we realized we had to put that project on hold and look at how we could contribute to emergency food access within the community. So within the last 4 weeks, we have been distributing food hampers, we like to call them food baskets, to members of the community. In the Jane-Finch community in particular, we're delivering around between 80 and 100 baskets every other week. And that has been something that we have been, initially we were delivering food baskets. That's how we started 25 years ago. And we put that project on hold because we wanted to make sure that we not only delivering food, but delivering food that we grow in Toronto. So we put it on hold and we started growing food in community gardens and 2 urban farms. And at presently now, the project that the initiative that we doing right now to COVID-19 as a emergency food access is delivering the food baskets, but we're also going to be cooking food for seniors within the Jane-Finch community and delivering food baskets also as part of that project with Black Creek Community Farm, Jane-Finch Community Family Center, and Black Creek Community Health Center. We're now getting ready to have that project start moving within the next week. So specifically around COVID-19, we want to make sure that we could deliver these food hampers, we could cook meals for seniors, and also we could grow food that we could donate to members of the community who need access to food. Looking at the broader picture of how we do this work, I think let's do this work collectively to get together, because this challenge is a challenge that in my lifetime, I never see anything like this. And I know for everyone on this call, it's a similar situation. So we're trying to do our best to make sure members of the community have access to fresh, nutritious, and affordable culturally specific food. And I have to say culturally specific food because initially we had a partnership with Food Share. We were distributing baskets, and we were getting comments from members of our community that they wanted the food to be more culturally specific. So within the last 3 weeks, we were scouring around the city to make sure that we identify suppliers who have food that is culturally specific. Some members of our community, they're very fussy with what they eat, and I think they should be so, because you want to make sure you have access to yams, sweet potato, dasheen, cilantro, and these foods that we're trying to grow in Toronto, but is not readily available in Toronto.
Thank you for sharing that. I'm curious too. So with the transition to including hot food items as well, what was that process like for seniors?
Well, that process is now about to roll out, because we were looking for funds, we were looking to access the space to actually cook the food, and we were mandated by a group within the Black Creek community who told us, because I'm a vegan and I'm very much connected to a lot of the vegan chefs, they wanted to make sure that we cook food specifically as vegan menu for folks on a vegan diet, because lots of other institutions are cooking food, but they're not committed to that particular community. So we're trying to make sure to step in, because vegan food, everybody consumes vegan food, but vegans don't consume all kinds of food. So the vegan food is like the universally accepted meal where everyone across the board consume. So what we're trying to do now is make sure that we look for these seniors who this may be their preferred diet, but even so, folks who have medical conditions like diabetes, they need special meals. So we want to make sure that we could contribute, and as funds come in, we try to cook more of these meals. But we can make sure that we have at least 60 meals a week for the next month, so that these particular seniors who are vulnerable could have access to these meals.
That's amazing. Definitely something that is very important and vital. And another question, was there challenges to finding a space to prepare these meals?
Well, it seems as though we have lots of resources in Jane-Finch, but it's just to locate. We already identified 2 areas to cook. Jane-Finch Community Family Center has been a good asset in that area. So we could be going and look at a space at Jane-Finch Mall. And we also may have access, if that's not available, to the Black Creek Community Health Center kitchen. So we're looking at the options and seeing which is much more accessible, and so that we could use that space.
Amazing.
And I must say that we collectively, Black Creek Community Farm, Jane-Finch Community Family Center, and Black Creek Community Health Center have developed a partnership to specifically look at the seniors within our community. And hopefully we're just about to get launched, and hopefully more resources come so we could look at this most vulnerable demographic within our community.
Great. Thank you so much for sharing that and sharing those programs. And I just wanted to ask, like, do you have a specific ask or in terms of community support that you need?
Well, we definitely need support. We need for sure. We, as Letitia said, we're fundraising also because we want to make sure that we could access resources for the community. Because much more folks want food. So we definitely need drivers. We need folks to help us to distribute the food baskets and also the cooked food. So that is critical. And we have a site called Black Food Toronto, where folks could register to get free food to the African Food Basket. But they also could register to donate to the African Food Basket so we could purchase more food and more resources. PPE equipment, we definitely need that because we want to make sure folks who helping with volunteering are safe when they're doing, whether it be on the farm or whether they're helping to distribute the baskets or pack the baskets or helping to cook in the kitchen. So drivers, packers, PPE equipment, donations is the critical pieces that we're looking at. And also volunteers, we definitely want to make sure we have access to volunteers.
Thank you so much for sharing that and letting us know what's happening. Hopefully we can get more into sort of what things could look like post-COVID during our community discussion.
Thank you so much.
My pleasure. Okay, so we will be moving on to our next speaker, who is Butterfly Sabrina Gopal from the Black Creek Food Justice Network. Hi, Butterfly.
Hi, everyone. Hi, everyone.
So I just wanted to read a bit of your bio and then you feel free to go ahead. Okay. So Butterfly Gopal is a longtime resident, mother, and organizer and community worker in Jane-Finch. She works with a number of grassroots movements, networks, and coalitions fighting for social and economic justice. For more than 10 years, she is an active resident of the Jane-Finch Action Against Poverty, JFAP, an action anti-poverty movement fighting to end poverty locally and globally. Her passion for community building, lived experiences of losing physical space in the community, and the call out for residents to join the Black Creek Community Farm led her right into the path of and production line to later support the growth of the Black Creek Food Justice Network. Butterfly is also a community health worker at Black Creek Community Health Center with a focus on community development, advocacy, community mobilization. She also supports folks one-on-one with systems and institution navigating with the framework of social determinants of health in the community of Jane-Finch and Black Creek. So thank you so much for being here. We're looking forward to hearing more about your work and the work of the Black Creek Food Justice Network.
Thank you so much. There's so much Black Creek. There's Black Creek this, so I totally get it. Thank you so much. Thanks, Rosie and the organizers for putting this on today. And it's an honor to present alongside with the amazing people that we just heard from today as well. At some point, photos will be shared from a community photographer, Errol Young, of different actions in the neighborhood. So I'm a member of Black Creek Food Justice Network, and for the last few years, I've been supporting the network in the capacity as a community health worker at Black Creek Community Health Center. And I think, so before we get started into answering some of the questions around food justice and during COVID, I'd like to share some of the background with the network and why doing resident community engagement, community-based research development by residents, for residents, by the community, why it's so important in terms of what we're dealing with right now in COVID. So I'm not going to say all of it. I'm just going to refer to Black Creek Food Justice Network as the network. So the network initially started back in 2013, 2014, focusing in the area of Jane-Finch, Black Creek. So for those who don't know the area well, we refer to this geography as Steeles, the north, to Falstaff south, and Dufferin to Humber River, the northwest part of the city, or northwest Toronto. The initial work was created and It was to create and explore the lived experience of food access, cost of food, quality of food. This work initially started back in 2010 with JFAP, the Right to Food food campaign. And it continued on through some of the work with Food Justice Network. In these initial years, residents were able, through community consultation, social media, campaigns, community meetings, radio shows, all these different ways to explore, reflect, define, and redefine what food security or insecurity was and what it looks like. So the meaning of food justice can be a local decision that is defined by the community. The experiences and situated knowledge of the community members characterize what justice means and looks like to this community. So I'm sharing this because through this work, we came up with demands. And through these consultations, we started to see issues surfacing very quickly that were very intersecting and interconnecting. So food policing, race and culture, food mental health, gender and body image, food capitalism and money, food labor and migration, food and the city, so food apartheids, gentrification. And these themes essentially developed our demands. And our demands, so I'm trying to give context because now when we see the headlines, we're seeing a lot of our demands are really the focus in solutions to COVID. So improving growing spaces and support for urban growing. So that's growing in our schools, being able to grow in hydro corridors, and permanent funding from all levels of government. Making food more affordable by raising social safety nets. So, you know, the minimum wage, we're now hearing, you know, this idea of these underdog essential workers and, you know, cleaners and grocery store clerks. You know, Emma talked about it earlier. Folks are getting a wage increase because of COVID, but we've always have been saying that these are the workers that keep our city going. And folks that are on OW and ODSP, these social safety nets are next to nothing. And in the context of COVID, you know, these folks in particular have more barriers in accessing emergency funds as well. So fighting justice for people who feed us. So this work is coming from Justice for Migrant Workers and endorsing their demands. And, you know, again, we're seeing in the news, you know, the inequities that are happening with migrant workers, the health and safety that's not happening, the outbreaks that are happening. And these are people that are, you know, getting our food to our baskets and to our homes. And stop criminalizing our communities. So undercover grocery store, undercover cops in our grocery stores or in our malls, as well as connecting food and mental health. So currently the network, we're finalizing our open statement in response to COVID. And what we're really seeing is that the state that we're in was already exacerbated before COVID. So with the demands I've just shared, we're seeing this being highlighted in the news every day. So I think I'm gonna stop there. I think some of the other stuff I've prepared are for the questions. But I think what I'd like to leave off with is, I think at this point in terms of the focus, before COVID, it still remains our focus is building solidarity, growing a base of residents in Jane-Finch, Black Creek, and other racialized communities, building solidarity with our migrant workers, farmers, educators, climate movements. And while emergency responses are necessary, important, and these mutual community responses are so beautiful, we also need to be working on the structural and systemic work and the policy change.
Thank you so much, Butterfly, for sharing that. And just on a personal note, I've just been part of the Food Justice Network for a couple of years now, and just really getting more involved in knowing about the systemic issues. So just seeing how these issues are just being exacerbated during this time, and just like the lack of response around keeping sort of these, like for example, the wages, like looking at how the conversation around keeping wages at a reasonable rate. So just kind of monitoring what's happening and seeing the work that we've been advocating for so long and what it looks like now. It's really an interesting experience, and I hope we can get more into that later.
I think one population I didn't touch on are folks that are undocumented and uninsured. This population, in terms of the different benefits that are rolling out, you know, these folks are really isolated, and with folks not able to work, income, housing, it's really desperate for folks. So, you know, organizations like having Black Creek Community Health Center to provide primary care, or, you know, to at least have a focus on this population, I think, in terms of health and in COVID, in the context that we're in right now, we need more responses like this.
Mm-hmm. Mm-hmm. I wanted to ask before we get into the Q&A, did you have a specific ask of like the participants or the organizations to support, or how to get more involved in the work?
For sure. We're finalizing our open letter, so that will be rolling out soon. So please share it, connect with folks. There, you know, our demands aren't just the Food Network's demands. It's a collaborative demand with other movements that are doing the work on the ground. So, you know, connect with the Food Justice Network or other movements that are, you know, smashing the food system in different ways. We meet the fourth Monday of every month, usually at Black Creek Community Farm, but we are online, so you can just email us at blackcreekfoodjustice@gmail.com, and we can follow up with the meeting details, and you can find us on Facebook.
Great, thank you so much. So thank you to all the speakers. That was really great information, and just to hear what's actually happening in the community. I wanted to give an opportunity to everyone here to participate in the discussion. So feel free to ask a question using like the video. You don't necessarily have to put in the chat. You can feel free to just ask. I think it would be a great opportunity for us to engage and really know who's here and even why you decided to participate. So feel free. I do have a couple of questions, but I did want to give everyone an opportunity to ask a question before I get into the ones I have. Don't be shy. Anybody? No? Okay, let's see. I know there was a couple of questions in the group chat, so if you did want to share them and say them out, you're more than welcome to.
So I think I'll share. I did have a question from someone that was sent privately on if the Jane-Finch Centre can support, I guess, their organization in providing leftover food. We don't have leftover food, although we wish we did. So what I actually recommend, and for those of you who are on the call, is, you know, give our center a call. I know the number is posted in the chat. And one of our staff will, you know, go through an intake with you and see where we can assist. We are trying to stay within our catchment as best as we can. I know that, you know, monies have gone out for different levels of government to help agencies support, you know, their food hamper programs or emergency responses to COVID. So yeah, for those of you who have those questions, please feel free to reach out to the Jane-Finch Centre, and, you know, where we can, we'll do our best to help.
Thank you. And you can submit your contact information in the Google form that we have in the chat, and then you can be kept into the loop and also receive the information, the contact information of all of the speakers today. Was there any other questions or comments from anyone?
Can I ask, is anyone using food rescue to match surplus food with need?
Yeah, so through Black Creek Community Health Center, we are partnered with the food rescue program. But from what I understand right now in COVID, there's because we all are dealing with different parameters around work and health and safety, it's kind of not fitting right now, but we are connected to the food rescue program.
Thank you.
I was gonna say from Black Creek Community Farm, and no, we have not partnered with Food Rescue. Most of our work, as I mentioned earlier, has been with our partners, especially Food Share Toronto, and the partnership that we now have with Afri-Can Food Basket, Jane-Finch Centre, and also Black Creek Community Health Center, which is focused on getting food and medical support to seniors in our community.
But I'd even like to say with that program, before COVID, the food insecurity, you know, it's been exacerbated before COVID. So initiatives like this, you know, we'll hear about a location and, you know, 2 minutes later, it's already gone, right? So that's saying to me, there's so many other workers or so many other organizations that are accessing these services in particular parts of the city. So that was even something before COVID that I was noticing as a worker.
So that's good to hear. I'm out in Northumberland County, an hour east of Toronto, and we're looking at you guys for examples of what we might be able to adapt. So it's good to hear the feedback on some of the things that are out there and what to be aware of. Thanks.
Mm-hmm. And I wanted to add just quickly as well, I think for us, and other folks may have probably mentioned this, for us, one of the reasons why we moved to the delivery method was really making sure that we can keep our staff and community members safe and not have too many people out and about when we should be social or physical distancing at this time. And I found that in terms of reducing the impact or the number of people out, having the delivery method really helped. The delivery drivers get to the door, of course they call or text and they drop the box at the door and they knock and they walk away, so there's no contact between them and the residents.
Yeah, we have the same out here with the Meals on Wheels, but they're only delivering like frozen food. They're not delivering warm meals like you're doing, which is great.
Well, I like to see that there are folks from Northumberland, you said, tuning in on this call. As a person who observes local food systems, this Jane-Finch Black Creek community, especially looking at the emergency food situations for folks in a low-income community who many are could be designated as food insecure. This is a real good thing that is happening here with this conversation, that we're looking for solutions. And I think if you scurry the whole of Canada to see a group of people of color organizing, I think this is probably the only place that you probably can find that happening at this level. So I'm very proud of the folks on this call and the community that we're being proactive in organizing so the community have access to food with the challenges they have. So we have challenges on all different levels. People are out of work. Young people, this summer going to be the most different kind of summer that they experience. So hopefully we look for solutions now and post-COVID. I don't know when is post-COVID. People talking about post-COVID. That seems very, very distant, but I think we need to make sure that we have the resources, identify the gaps in the lack of food in our community so that we could be prepared and make sure that from babies to seniors is looked after.
I'm going to respond to one of the comments in the chat from Browns in regards to organizations receiving emergency funds. So Jane-Finch Centre did receive from Second Harvest, I think it was about 12,000. So that will be going towards our food hampers. So like Letitia mentioned, you know, these things cost money to do weekly. So we are putting that money in towards our hampers and to continue this as long as we can, and as long as, you know, this continues.
And I like to say the Afri-Can Food Basket also receive funds from Second Harvest to provide emergency food, and also from Community Food Centres Canada to make sure we purchase food baskets, especially culturally specific foods for community. And we also receive funding from United Way for the Seniors Partnership Program at Jane-Finch Community Family Center, Black Creek Community Farm, Black Creek Community Health Center, and the Afri-Can Food Basket. And I'd just like to say, I know a lot of folks posting questions in the Zoom group chat room. Rosie, it might make sense to read out some of these questions because there's some good questions, but folks may be shy in speaking up. So I've been on a lot of these calls, and I think if you read out some of the questions, we in the panel might be able to answer accordingly, other than, you know, because some very interesting questions are there, but it might be too much to for us to coordinate it, other than you as the facilitator might be able to pose these questions and we could probably respond.
I agree with that. Can I say something? Can you guys hear me?
Yep.
Yeah, I'm never shy. So thank you guys so much for assembling this panel. I think while emergency moments and emergency times bring to the fore exactly what the panel was mentioning around, like making them more acute, the need, the structural deficits, and also focusing on bare essentials. But when we come out of this, I think we need to start thinking about now connecting food insecurity with other justice issues, right? So whether it's precarity in housing or poor work, all of these things are connected. So and of course, everything everybody's doing is literally all-star level. But I think this is precisely what the present state of things want us to do, to just focus on food security, or just focus on barely feeding each other or barely housing each other and not make the connections. So I think once we come out of COVID, we have to think ahead about how to like coalesce all of these things that we work on, right? So just ensuring that I know we need to feed each other and house each other and keep warm and make sure, you know, these damn bylaw officers don't kill us or the police don't kill us, all of that, guaranteed. But when we come out of it, we have to start to articulate these things together, because all of these things we've been facing, right? So let's be on the front line of that, of connecting food security, food insecurity, the way our organizations are poorly funded, the way we're not even in these present government schemes, we're not included. So just thinking about how we make those arguments, and remember that food and is just one part of all of the things we face. So that's just wanted to add that.
Oh, thank you so much for bringing that up, Sam. Definitely, you cannot talk about food insecurity without talking about housing, without talking about employment, without talking about so many other issues. And like you said, they're very much connected. And it is very, very important that when we're talking about food justice or we're talking about food security, that it also means that we're talking about employment. And it also means that we're talking about all these other systemic issues, and that they're not separate at all. And your point around like being focused on like the emergency needs, and not that it's important that while we're focused on the emergency needs, that we're also looking at some of the other, we're focused on like post COVID, and we're planning for post COVID. And that's really, really important that we do that.
This is a really great discussion. So yes, like Anand said, I am compiling a list of questions. So I will start asking some of the questions now. If you do have more, feel free to include them in the chat. So these first two are specifically for Alicia. This question, the first one is, are you measuring or keeping stats regarding the changes taking place during COVID?
I think that's Monica. I did respond to her privately. Yes, we are statting things. We have a form that our staff are using when they're calling and doing intakes with clients and having a conversation on, what their needs are. So this is, going outside of their needs for food. This is, it can have a conversation about what their needs are with their children who are at home and, how they can teach and they don't have, access to internet or, things to help them with the, at home schooling right now. So our conversations go past the need for food. So yes, we are statting in that way. We continue to also receive, information around financial needs. So as you all know, all of the different benefits that are coming out are changing weekly, if not daily. So we are able to stat those things as well. So yes, we are able to do that.
Great. I think you did answer the other one already as well. The next question is for Letitia. There was a question around, somebody was curious to know, how long a period could you feed 2,000 people for $60,000?
So basically, one time. They get a box of vegetables that can feed them for a week, one time. That's it. So it's not multiple at all. So the money doesn't stretch that far.
I can add on to that as well. I do the shopping for our hampers. So we're spending at about $2,500 a week, $2,000 to $2,500 a week. And we're able to, service about give or take 130 to 150 clients. It is very expensive. We really try, to stay within a budget, as well as, keep in the back of our minds of, what we're putting in the food hampers. Our food hampers aren't large. So whereas, we'll try to make sure a meal goes in there, whether it's, pasta and pasta sauce and vegetables, we'll add on, maybe salt and flour or, detergent or something additional with that. They aren't large food hampers, but that's kind of where we are right now in terms of our spending. So in about a month, almost 10K.
Wow. Okay, I will go to the next question. The next question this one was directed to Anand, but anyone feel free to answer as well. What were the barriers in infrastructure or regulations to deliver ready-made meals to clients? And what can governments do to help organizations like the Afri-Can Food Basket?
I'd like to respond first to the food basket. We didn't have access to a warehouse. We wanted to do a partnership with FoodShare, but FoodShare has gotten so busy because all the time is used up at their warehouse. So we had to access another institution in the community, so not just outside the community, Young Potential Fathers on Western Road. And that's where we're packing the food baskets. We started packing 100 baskets about three weeks ago. And now we're packing 300 baskets a week at this site. And also the Afri-Can Community Support Services, that is headquarters on Arrow Road. We're also supplying bulk country-specific foods to this institution, and we're getting the response has been tremendous. Hopefully we get the resources to respond to all the asks that we get in for folks to have access to food. The cooked food that the question was asked, we are now in the process of starting with that program. So we have the funds, we have the space, and now we have the chef. So we're ready to start cooking the food and send it out into the community. The government response. I think all of us need the support from government in making sure that we deliver the goods to the community. We need the money to buy the food. We need the money to farm. We need the money to cook food. So we need the resources. As you know, traditionally, when you talk about food security, community food security, the type of program that we're doing now, like with food banks, is something that we hope wouldn't have been around, but food banks are still around because folks are not getting enough income. And we're seeing really COVID-19 really show the gaps with this system of how people would remain in poverty. So I think there's going to be a lot of learning for folks. So we need the support from the government for sure. And what we could get from the government is the funds to do the necessary work in our community.
For sure, the governments have a role to play, but I feel also like corporate are also culprits in the system. Last year, not too long ago, No Frills put up a ban or a policy for folks not to use strollers, backpacks, reusable bags, buggies. You know, this is like historic in this neighborhood, like the attack on poor racialized communities. And you know, if grassroots groups like JFAP and the network didn't push and make noise about this racist, sexist, ableist policy, they wouldn't have removed it. You know, we're hearing right now, okay, well, not right now in COVID, but you know, seniors who might not be able to afford food and are found that they didn't pay for the food are getting banned from not just No Frills or the grocery store, but the entire mall for the year. So yes, governments, you know, they're especially in this neighborhood, you know, they've been MIA, but these corporate like, you know, Walmart with automating, okay, I know this is COVID, but there are certain things that you're seeing a direct attack on workers, the most precarious workers, you know, ones that don't have benefits, you know, aren't full-time, they're working a few different jobs, you know, they're mature people, they're probably not going to get work. You know, the role of corporate in the food system is really appalling.
Well, I would like to support what you said because capitalism, this is what it is. If we're talking about real change, we're talking about looking at the way government is governing the people. And if we need real change, we have to look at this capitalist system for the future. And I don't think it's functional because the rich is getting richer and the poor is under more pressure. So what you said, Butterfly, is definitely something that need to be spoken about.
And I think also we need to brace ourselves for post-COVID with just ramping up the criminality of people in this neighborhood. Right before COVID, CCTV cameras are installed. The subways are here, LRT, I'm seeing construction, you know, it's happening on Finch. And we already know that people who are dealing with substance use, addiction, who are on the streets, the interface with the police isn't to get them housed at a hotel by Aero at the airport. It's about charging, not even, probably just arresting and throwing you in jail right now. So like, I think post-COVID and the criminality as well is something that we should start doing some more action around. Because like I said, as senior, you know, we're hearing seniors are being banned for not being able to afford food. So what are our young, you know, Black and racialized people, men, boys with backpacks, what are like, so these are the things that I'm thinking about in terms of post-COVID.
And Butterfly, that actually, your point there actually goes into a question that was asked. So the question is, how does food justice and advocacy look like now? Because, you know, we can't get together in groups and whatnot. So how do we protest? What would that look like? And how do we advocate?
I can take a stab at it. I think as Sam laid out very well, is food justice looks like fighting for 15 and fairness and fighting for fair wages for everyone. I think one of the things that different folks have been doing is the joint open letters and joint letters to different government representatives, and also petitions. Like I've been seeing a lot of petitions of late during COVID. One of the successful petitions was the petition around the community gardens and making the community allotment gardens an essential service so that folks can get into the gardens and farm together. I think in our own homes, there are several ways that we can connect with different groups that are doing the work, but also I think there are ways that different groups can also come together to work together to push. Like I mentioned, right? If we're seeing that cleaners are essential workers because they're literally keeping us safe from things like COVID and viruses, and that we see that they do need better pay, then how do we fight to make sure that that pay stays? And that pay is actually living wages, and that is not on the backs of Black and brown people. Canada, we don't have race-based data on the impact of COVID, but we know from the statistics in the States, and we also know from the statistics in terms of who we know are the PSW nurses, who we know are on the front lines are the cleaners. Who do we know that are on these farms across Ontario that are making sure that we have food on our shelves? We know that they are dominantly Black and brown people, they're dominantly racialized people, they're dominantly low-income people. So I think we need to sort of look at what other groups are already doing, not to duplicate work, but how can we connect with them to really push around some of the wage gains that we've had. And also in terms of fighting for fairness for migrant farm workers who are living in horrible conditions so that we have food on the shelves for us to eat, right? So I think it's just tagging onto some of those issues and looking at ways that we can collaborate and fight together. I think we have a moment now where more and more people are becoming aware of the inequities, because I think one of the things COVID have done is bring it to the forefront. I find it very interesting, you know, seeing Doug Ford's t-shirt about we're all in this together. When I sit there and I'm like, well, I don't live on a 100-acre house with whatever at my disposal and things stocked and all of that. So I don't know who he's in this with, or I don't have cheesecake recipes to go online to show people how to make it. You know, people are struggling trying to put food on the table. And I think the more we can come together to do that, the better.
And speaking about petitions, I must applaud the folks from the Toronto Urban Growers or Urban Gardeners in getting and mobilizing the community to make sure that folks have access to community gardens. But I've seen in other communities around the world, and I think Brampton to some extent, initiate a program whereby people are able to grow food in their backyards and on balconies. The government need to make folks, make available to folks what the resources they need to grow food, especially in their backyards. And I think within this community, Jane-Finch Black Creek community, it would be good to see if resources become available so that folks could have access to prepare their backyards, have access to organic soil amendments for the gardens, seedlings, and tools. And I think it's not about giving them food, but they're producing their own food. And if, I don't know if you folks see, but there's been an upsurge in people wanting to garden, people, for instance, trying to buy seeds to farm and for community gardens is a problem because seeds are not available. The government definitely should make available resources so folks could actually grow their own food and take the opportunity to, because folks are so excited about growing their own food now, to make sure they support them in the best of ways that they could so that people could grow their own food. And there's a lot of expertise within the Black Creek community to make sure that we encourage folks, what we call garden animation, so that folks could actually be growing their own food. They could be growing collectively to share the food. I've seen some interesting projects happening in different parts of the world where folks, one house lot growing tomatoes, the other one growing beans, the other one growing, so that they grow things in bulk and then they come together and distribute it. So we're producing our own foods within this particular community, and we have our own local food system that is much more responsive to COVID than just receiving food. So it means folks can be more self-reliant. Other than accepting food, they'll be producing their own foods.
Thank you all for all those comments and the questions. I do want to be mindful of time. So we do have a few more questions, but I do encourage the speakers to go directly into the chat to answer some of them. And I just wanted to ask just two more questions. There's one question on, so hearing about seniors calling 911 regarding food, is there some sort of outreach component to reaching those being served because of stigma, shame, or lack of awareness? So what does the outreach look like around that? If anyone wants to answer that question.
Yeah, in terms of outreach, earlier, like we did like an online blast and also shared it with all the community organizations, and they were able to register folks. But I think one of the most effective outreach that was actually done through Jane-Finch Action Against Poverty and also through staff at Black Creek Community Farm is that call into some of our aunties. I call, the seniors in our community aunties, is picking up the phone and calling some of the aunties. And also even like we were able to get support from one of the other seniors who was able to also call up other seniors that we don't have money for and direct them towards that so that we're able to support them with some of the needs. With that being said, I of course, it's never enough. And my main worry as well is, having seniors that are not so connected maybe and are stuck at home and are not mobile and don't have access to food and to different activities. But I think this new partnership that we have with Afri-Can Food Basket and also with Jane-Finch Centre and also Black Creek Community Health Center is really focused on seniors and providing sort of like a wraparound support, being able to get them blood pressure, equipment, getting them glucose test strips, being able to have a staff person or different organization kind of check in with different seniors. So not just providing them with food, but also trying to figure out what are their needs and supports that they have, and what are the ways that we can collectively bring resources together to support them. I think is very important. And I think, our community, and I always say this in Jane and Finch, one of the things that I think we do really well is really look out for each other, and check in with each other. And even for me, I had one of the aunties also call and check in on me. And that felt really, really sweet that she's asking, are me and the kids okay? And I'm like, are you okay? And we had a really good laugh about it. So, but again, yes, it's true. There are probably more that we haven't been able to get in touch with. And there's more that we could do to check on our neighbors and to see how we can take care of each other.
I think, our partnerships as well are so crucial in the work. So having workers in Toronto housing, we have, a lot of high-rise or a lot of buildings, Toronto housing buildings. It's really being able to talk to each other, I think. We have at Black Creek Health Center, there's frontline outreach workers. So literally they're out in community connecting with people to connect to these resources. So I think, how we're sharing information, I think that's also like something that we do really well is, the networks in the community, it's seamless where things are getting out. As a worker, I have like 2 to 3 tabs always open where our emergency application food boxes, because that's always one part of it is food, but it's always layered with, our families aren't, one-dimensional families. We can have families that have our seniors, our grandparents, our aunties living with grandchildren and great-grandchildren. So the approach also needs to be very multidimensional and knowing the community and knowing the structural issues. We're not walking in blind. We walk knowing that this is structural, and we walk knowing that these are our relationships that we've built over a long period of time. So there's trust. And as we're starting to gather race-based data, I think, this is where the trust is so important because, I called an auntie one time and I asked, some health conditions, and she's, why are you asking me? Right. So like, and we were able to talk through that and why it's so important that we are gathering it for Anand's food emergency response. And I think all of this is really important in responding.
Yes, it's critical for us to keep evaluating the work we're doing so that we could be more efficient and know where the gaps are within our community and know where we should focus. But I must say, the organizers of this presentation must be commended for a work well done. When I look in the Zoom group chat room, I've been on a lot of calls and I haven't seen this kind of response. So that means they should probably have a round 2 within the near future, because we haven't even touched the tip of the iceberg in looking at the comments people making, and they should be spoken to. This has been tremendous. So I must thank Rosie and all the organizers of a brilliant job of bringing this important conversation to the community. And it's not just the community. We getting calls from all over the country, it seems. So I'd like to say we need to do this again for sure.
Thank you so much, Anand, and thank you to everyone. I know we're running out of time. This is such a great conversation, and it can continue for hours. And I definitely want to recognize the support of Fareed and Claire at the Jane-Finch Centre as well. We all really worked together to put this together. I did want to, I know it's almost 5:30, but I did want to do 2 more things. So if each speaker could maybe share one action or one thing they think we should do to prepare for what's ahead. That could be something that we can close off with. And I did want to give any other organization that is here maybe a minute or 2 to share what they're doing as well, just to kind of wrap up.
Sorry, Rosie, can you repeat that question again?
Oh, sorry, I know, I kind of rambled. So essentially, I wanted to basically ask, what is a step or something that we can do to prepare for what's ahead? So even just one thing that you want to share.
I have 2 things.
Okay.
One thing, today's May 21st, so Workers Action Center is doing an online campaign today. So please check that out. And this coming Monday is the fourth Monday of the month. So email Black Creek Food Justice at gmail.com to get meeting details. This really goes to what Sam talked about, like it's not just food, and how do we organize around all those different layers, and that's been the focus of the network.
I can follow up there. I think we are, doing a good job as community agencies right now, and I think we just need to continue to collaborate and communicate with one another and make sure that we're all on the same page, and and doing what we can for the community in pockets instead of. I don't find that Jane-Finch operates in silos, but just to spread that word out there for anyone else who's on the call and having that difficulty within their community, like work together. Because it's a pandemic. You're not going to be able to get through it on your own.
Definitely. And I guess, to echo and support what Butterfly and Alicia have said, definitely join the Jane-Finch Action Against Poverty, the Black Creek Food Justice Network, Workers, the call out from Workers Action Center, some of the work that Justice for Migrant Workers is also doing as well is really important. And then, in terms of the steps ahead, like I think the more we can collaborate, partner, support each other, and to push, I am very interested in using some of the language that these politicians have been using at this time to really push for folks so that we can have some equity. So I think the step ahead is that, again, and I'm gonna say, folks are not just essential workers only during COVID. They have always been essential workers, and they have been devalued because of racism, period. And I think we really need to value that work, and we really need to fight for everyone to make sure that we have a better, and it is, when you're doing that, it is a food justice work as well, right? Because we know that it's very much tied into income, where you live, impacts sort of the type of assets and the type of food that that you eat, and the type of food that you're consuming. So I'll end it there. Another piece that I didn't say about me is that I work with the chair of Seed Change, which is an international organization working with small-scale farmers across the globe. And one of the key important pieces of work that ties in to some of the stuff that we're doing is around making sure that small-scale farmers have the supports that they need to be able to grow the food to feed communities, because we know that they are the real ones feeding us.
I'd just like to just say that as a community, just echoing a lot that was said before, that we keep organizing collectively in the community. I know all of us are so consumed just with the work we're doing right now, but I think a collective approach for the Black Creek Jane-Finch community, we should look at some way of making use of the resources, and making use of the resources from either TRCA and more specifically York University, with the capacity it have as an institution to make sure that we look at what we're doing, have the right evaluation tools so that we could make sure post-COVID, we have a long-lasting response that is not just emergency, but is the community defining our own community food security. And the necessary resources, you see how resources flowing from out of our 350 million, 250 million, they could do it at any time. So it brings a disaster to make them realize what they need to do, because they could have doing this at any time. And communities could be food secure and more self-reliant. So hopefully we could get together as a network of institutions. And I know this is about food, and there's a lot of other areas: domestic violence, illegal immigrants, immigrants who actually undocumented workers. But for food specifically, we need to make sure that we have a good grip on the community's needs and access to affordable, fresh, nutritious foods.
Thank you, everyone. That was amazing and really great point. So it definitely, like Alicia said, we can't do this alone. So it's really important that we do continue to work together and support each other. As the organizations mentioned, that there is a need for support, whether it's donations or volunteers. So definitely keep in touch, get in touch, spread the message, use your platforms, use social media to share what's going on and to let people know. It's great to hear that we had people from all over, not just Jane and Finch, participate. And that's because we did share this meeting and share the message, and we can share what's going on in our community. And definitely advocacy. So keeping that in mind around advocating for the social issues that are being magnified during this time and looking at ways that we can work together to really address these issues. So thanks again to the speakers. I did want to use this opportunity to give other local groups that are present to kind of share what they're doing. So if there is anyone interested in sharing what's happening at their organization, feel free to do that right now.
Jonathan again from Northumberland County, Sustainable Coburg. I put a link in there to a hackathon that we did 2 weeks ago.
Hi, this is Binda Goldenberg. Can you guys hear me okay?
Yes, we can hear you.
Yeah, okay. I'm with LumaCare, one of the managers there for community and client services. And we've sort of undertaken a number of different programs right now that we have implemented during the COVID-19 crisis, from Meals on Wheels to serving our clients with grocery baskets and comfort packages, like care packages of essential items. And also we've paired up with community partners to provide hot meals and warm meals. We've paired up with the City of Toronto and the Marinara Boys for hot meals. And so they're being donated to us. And these are non-vegetarian halal pasta dishes that we deliver to our clients on the same day. And we also have a partnership right now with Maple Leaf Sports and Entertainment and United Way and Second Harvest. And they are providing us with halal non-vegetarian meals also. So these are ready to warm meals that we're handing out to our clients. And the grocery baskets are items that we're purchasing on our own. And the baskets are actually costing us anywhere from $20 to $25 each. And we're giving them to our clients for $10. And during this whole crisis, we have decreased all our Meals on Wheels to 50% off. There was a period of time we were able to give them away for free, but we weren't able to sustain that for too long. So then we had gone to 50% off to service those clients. So those are just some of the things that we're doing at LumaCare.
Thank you, Binda. Thank you for sharing that.
Yeah, and I did send out our whole processes and procedures, and flyers if you want to share those with the rest of the team.
Definitely. Thank you. Was there anyone else that wanted to share what's happening at their organization? So it doesn't seem like there is. So again, thank you to all the speakers. Thank you for everyone for participating. Again, if you want to get this recording, stay in the loop as to what's going on, please feel free to leave your contact information in the Google form and we will follow up with you there.
Okay, thank you.